Hi, Dr. Marcia here, and today I want to talk a little bit about the consequences of trauma, especially in the context of people who are buying into conspiracy theories. Trauma is a very devastating effect of experiences that are either life-threatening or so distressing that we can't even tolerate them, or even it can come from witnessing very upsetting events. And if we have trauma, especially early life trauma, it can have long-lasting repercussions. Some of the symptoms that we don't even realize are caused by trauma are a sensitivity to any kind of stress. So we are much more vulnerable to the kinds of stresses that other people would bounce back from more easily. So trauma lowers our resilience and our ability to cope with ordinary stressors. Trauma also can make us more paranoid. It can make us worry about people and worry about situations and see bad things when they aren't even there. And that's because the bad things that happen to us as a child make us more suspicious and more fearful. And the other thing that trauma can do is it makes us what's called hyper alert or hyper vigilant. So we're always like looking around for the trouble, for the bad things, because we feel that we need to protect ourselves from potential threats. And so when it comes to conspiracy theories, people who have childhood trauma and even adult life trauma are more susceptible because they tend to be more vigilant, more paranoid, and a little bit more rigid in terms of their thinking. And they also fall into this thing called confirmation bias. And what is confirmation bias? It's when we have a belief and we ignore everything that does not support our belief, and we see only things that do support our belief. So when these people go online, they ignore all the facts and they only see the things that appear to support their beliefs. And then they keep going online and finding other like-minded people who say the same things as they believe. And so it supports their beliefs in these conspiracies. Now they say, you see the facts, here are the facts. But these are not facts. These are things that are written down online, and the confirmation bias makes them buy into them. So trauma makes people very rigid in their thinking and very unable to change their mind. Now, the old definition, or even the current definition of a delusion, is a false, fixed idea, an idea that is not true and that a person cannot let go of. And these days, people with trauma sometimes have ideas that are close to delusions because you cannot get them to change their mind. Even though these ideas are patently false, they are utterly convinced that these ideas are the absolute truth and the rest of us are delusional, which is tragic because they are going to make choices that are very bad for them and bad for their families and bad for society. You know, there have been many stories I have been reading lately about people who were COVID deniers who were lying in their hospital beds dying, and then either at the last minute realizing that they had been incorrect or passing away still holding on to the belief that COVID wasn't real and they must be dying of something else. It is so tragic because these deaths were unnecessary, and most of these were very young people in their 20s, 30s, and 40s. It's really, really, really sad. So trauma, though, is a very main factor in people buying into conspiracy theories because they get paranoid, they get rigid, they have this confirmation bias, and they keep looking for information that justifies and validates their false beliefs. Trauma also makes us more irritable, and so we're much more testy, we're more touchy, we're less tolerant, we're less willing to entertain different opinions because everything bothers us, everything gets on our nerves. So we're less likely to have a reasonable discussion because when somebody contradicts us or disagrees with us, we're more likely to get angry and tune them out. Trauma does a lot of really difficult and dangerous and destructive things to us. And of course, it's so important to recognize when we do have trauma so we can get it treated. So hopefully we can stop buying into conspiracy theories, we can stop having paranoia, we can stop being irritable and rigid and going for the confirmation bias. So how do we recognize that we have trauma? Well, we can look at our symptoms. Do we feel very often that we're in a fog? Do we space out and kind of lose track of time? Are we hyper vigilant and aware of everything around us? Do we feel that people are plotting against us or talking badly about us? Do we have difficulties falling and staying asleep? Do we lose our temper at the silliest little things? Are we impulsive and maybe even self-destructive? Do we burst into tears at just odd times without any good reason? Are we apathetic at times or just forgetful and confused? These are all signs of trauma. If we have any or all of these symptoms, it's really important to get help. And trauma requires one specific type of treatment and possibly another. The specific type of treatment for trauma is trauma-focused therapy. And there are many different modalities of trauma-focused therapy, including EMDR, or cognitive processing therapy, or trauma-based cognitive behavioral therapy, or mindfulness meditation, mindfulness-based therapy. These are all specific treatments for trauma. There's also dialectical behavioral therapy, which also is very helpful for people who have had trauma. Another modality for trauma is medication. And this is something that you can discuss with your doctor, preferably your psychiatrist who has, a greater experience and knowledge base about psychopharmacology. So trauma requires treatment. And the sad thing about trauma is that it takes a really long time because it goes deep into the structure and the function of the brain, altering them in a very profound way. On the other hand, trauma can be treated. And I have seen patients who have come into my practice very, very damaged, I guess I could say, from trauma, but with patience and time on both of our parts and intensive treatment, they have made remarkable recoveries. So trauma can be treated, and people who are suffering enormously from trauma can go on to live very positive and constructive lives. But treatment is absolutely essential. You cannot get over trauma by reading books, by watching programs, by listening to podcasts. You need to go into intensive treatment to really deal with those wounds, because there's a whole process of facing your wounds, grieving your wounds, learning to love yourself, learning to heal, learning to forgive yourself, learning to let go of the bad things that happened to you. And it's a really long process. Because trauma goes so deeply into the structure and the function of the brain, it takes that much time to heal and to recover from trauma. But we can do it as long as we are getting the right help from the right people in the right way. So be aware if you have symptoms of trauma, and if you're getting caught up in conspiracy theories, consider the possibility that it might be based in some early life trauma, and that this is causing you to have confirmation bias, irritability, hypervigilance, paranoia, and rigidity, and that's possibly why you're believing some of these theories, which really, the truth is, are not the facts. This is Dr. Marcia Sirota. Stay well, stay safe, and I'll be talking to you very soon.